Hey everybody, how's it going? In this episode, I had a chance to speak with some nurse practitioners, and I think it ended up being a really good conversation. It was fun and lighthearted, but also had moments of seriousness. You know, during my day job, I work in the marketing field, and I've had a chance to work with people all over the medical world, everyone from nurses to firefighters to doctors to marketing directors, and so this episode gave me an opportunity to focus in a bit on one part of the profession and just ask some of the questions that I wanted to. I think we had a good time. It was a lot of fun, and hope you enjoy.
It's time for Gentlemen in Moderation.
It's a dead man's body. Who could ask for more? Everybody's coming. Leave your body at the door. Leave your body and soul at the door.
Don't cup the mic.
So first of all, thank you everyone for being here. I know this sounds like a radio show now. There's like a podcast. But one thing I wanted to throw out right out of the gate, because it's something that I don't know, and obviously you guys could educate me on this, is what's the difference between a nurse and a nurse practitioner? Besides the spelling.
So they're actually both, it's the same thing kind of, but so we all start off as nurses. Nurses can be associate degree, they could be a bachelor degree, and then nurse practitioner usually is a master's or a doctorate, but you have to be a nurse first. So we still call ourselves nurses, although we're nurse practitioners. So it's kind of a complicated subject, I guess.
It's an advanced degree beyond nursing. It's going from a nursing role to making more medical decisions through, basically the same kind of role, but you're making more of the choices rather than less of the task work than you would do in the past.
Yeah, definitely entails a little bit more responsibility, I think. We all went through school together, and that was about 2.5 years.
Yeah.
So to get our masters
Yeah, that's beyond your nursing degree to begin with, so it's another 2.5, 3 years beyond a traditional nursing degree.
So then all of you worked simultaneously to getting your degree?
Yep.
Yes.
And what was that like?
Stressful, to say the least.
I'm surprised my husband's still with me after that.
I'm surprised I still have friends.
No, I think we definitely all leaned on each other throughout, and it was a stressful period of time. In my life. I'm glad that has since passed. Not to say that I don't have additional stress now in my career, but it's different now. It's nice to actually be doing what you work towards, I think. So.
Now, did you all start out going back even before this degree wanting to be nurses?
I always wanted to be a nurse. That was something I knew pretty much right out of high school.
Yeah.
Nurse practitioner was something that kind of came up on the radar later, and I was like, yeah, you know what? I think I want to do this, and I knew Kate, and we went to school together, and I'm glad I made that choice now. For sure.
I think the medical field has changed a lot over the last probably 5-10 years. So nursing has changed. So I think same as Tegan, I knew in high school that I wanted to be a nurse, and once I finished nursing school, I was like, I want to be a critical care nurse. That's all I want to do. And then once you're in your career and you're going through and you're learning, and then you kind of hit you capped out. You're like, I've learned a lot, and I hit my maximum point at this point in nursing. So I was like, I want to go back and I want to learn more and have more responsibilities, and I never thought I would go back to school, but I did, and I'm glad that I did. So
Yeah. The day that I graduated with my RN, I remember specifically saying I would never go back for a nurse practitioner. I was very adamant.
Yes.
And then it wasn't until you brought up, that we should maybe look back into getting back in school and getting, advanced degrees, and it worked out. So it was a good decision.
yeah. And I know I wanted to be a CRNA, which is another advanced degree from the nursing aspect. It's like an anesthesiologist, a nurse anesthetist. And I talked to my husband about it, and we kind of talked about both fields and what would be most beneficial and most flexible for our lifestyle. Like, I didn't want to just get married and then, like, never see my husband. So we kind of made the decision that nurse practitioner would be the best route for our family. And I'm so glad that I went that route instead of the CRNA route, because we actually get to interact with the public more, not when they're sleeping, like put them to sleep and that's that, you know. So I think we all made good decisions going the route that we went.
In the same aspect of that, like, I'm glad we did family nurse practitioner versus a specialty, because we're not limited to doing one specific thing. And a lot of people do either peds or psych or emergency, and they're stuck in like one kind of area, versus as a family nurse practitioner, you can still go into pediatrics, you can still go into emergency, you can still go into specialties, but you're not stuck in one role. So even if you go, hey, I've done ER for so long, now I want to try something different, I'm able to do that. And it's basically a changing field, and you can use your degree like to its maximum, I feel, that especially instead of like going into a specific area.
I noticed that I did like a little wiki research, and I saw that you could go into a specific area, or you could do that. So that's interesting to hear. So take me through. Is there a way to take you through a typical day, or is it?
No.
No.
No. It's every day is a completely different thing, and that's part of the reason I love my job. It's never, this is the same thing every day. You don't just go home or go into work and log into a computer and have the same thing to do every day. It's something you get to go interact with the public. There's different interactions with people and different situations. No matter the same person's coming with the same complaint, they're coming in for a different reason or for a different background, and they have different medical complaints. So it's always something new every day.
And just going back with the family nurse practitioner route, so we all majored in family practice, but we all do different things. So Lindsay is a cardiology nurse practitioner with her family practice degree. Tegan is an emergency room nurse practitioner. She does emergency and urgent care. And then I do critical care and pulmonology with my family practice degree. So going based off of Tegan. So we all have the same degree, but we all do like completely different things with that degree. So, and that's the cool thing about it too, is like, which based off of our prior experiences as nurses, that's kind of what led us into the careers that we chose. Tegan was a ER nurse. Lindsay and I worked together in the ICU. So kind of based off of that, Lindsay went into cardiology, I went into critical care, and Tegan went to ER. So we've all had experiences in those particular fields. So our days we have lots of stories, believe me. Our days are crazy.
I will ask. But no, what's it like? Just because the whole premise behind the show, Gentlemen in Moderation, is my thing, my curiosity with meeting interesting people, and it was wanting to explore beyond myself. I had many years where I was doing stuff and very focused on a path that I was doing and talking a lot, which obviously this is available here. But the difference is now is just trying to listen more. And so I guess generally in my day, no one will die. So what's that like, in an experience of how is it that you can, go to work and have to deal with situations like that, and then, be able to like either unplug or, do what you do?
Well, I'll take you back to the beginning of time. So when I first started as a CNA, so that's a certified nurse's assistant, and I was 18 years old, I remember my first day on my job, we had a patient who died. And I remember I walked into this room, and this lady's sitting straight up in bed, and she passed away. And I had nightmares for weeks, and I would cry to my mom and be like, oh my God, like, how am I going to be a nurse if I can't even handle death? And it just messed me up. But I don't want to say that you get used to those things, but you kind of do, and you kind of cope with it, because that's your job. Like, our job is to take care of the sickest of the sick patients and either get people better or help them transition through difficult times and through death. And it's not that we got used to it, but it's just what we have to do. And that's what I would want from someone who is taking care of my family member. So you just have to put on a good face and go get them.
Yeah, it's like coming from, I mean, same thing in ER, like you go from having a patient that you guys are coding in 1 minute and doing CPR, they pass away, and then having to go and see the next person and take care of them still and be able to, in your mind, keep everything together, and you have to compartmentalize a lot. It's definitely like, okay, this happened in this room, now we have to stop and move on to the next person and do what you can for them, and it gets hard at some points because you do have to like turn yourself off as a emotional person. It's like you have to turn yourself like from one switch to another, like hey, you can't be physically like emotionally involved in what just happened before, but then you got to go take care of 4, 5, 6 more people that aren't dying and not show them what you just saw.
And you build up your walls. Like we
Yeah,
have
you
our
do.
walls that you build up just so you can mentally get through the day and not, I can't be in there crying when this family is losing someone, But sometimes, I mean, I've had times where I've had to step away and go cry in a separate room because I'm human, like you're human, and sometimes your human feelings, like you just like you break down and you cry because it is sad and it is awful. And
on the flip side of that, then obviously you have to experience those things, but how can you handle humanity on a general level? Because I'm sure you see all kinds. Like I know from experience, even going into an ER, I'm like, I have the flu, and I'm like, I'm dying. Somebody help me. And all this. Yeah. So it's like
we were just talking about like the different, like you think you've seen the craziest thing, but every day someone tops that crazy situation. So
Right.
it's
Just from just a quick story, like I had a young kid that was basically had appendicitis and had to go right for surgery, and I'm trying to call the surgeon and get the pediatrician involved and trying to get everyone on board to get this kid to where he needs to go as a critical patient. And next door to this person, I had this family who's just complaining that they hadn't been seen yet. They haven't been seen. And they're here for like a sore throat that they were already treated for 2 days ago, and now they're back. And I'm like, I was trying to take care of this kid who is sick and can basically die at any point, and they're out in the hallway yelling and making a big scene and about something more minor that they're already being treated for, and you're just kind of like trying to keep yourself together, trying to like treat both patients, and sometimes it's very hard because people don't understand that there's other things going on outside of them, and I don't feel like public sometimes even sees that, and it makes it kind of hard sometimes because it's not like I don't want to help the other people, but sometimes there's definitely a priority of where you need to be, and I think more people need to understand that as well.
that's the hardest part of our job is the public. Like, you're at the hospital for a reason, you're admitted for a reason, you don't feel well for a reason, your family member's dying and we feel so bad for you, or something's going on, like nobody wants to be in the hospital, no one wants to go to the doctor, but sometimes people can just be so unrealistic, and there's so many people that need our attention and our care, and sometimes we just have to be patient, and that people and family, they can make our jobs either amazing and they're so grateful, or they could make our jobs really hard. And like I said, there's tough situations that we're all in, but there's nothing like getting yelled at by someone that you don't even know, or you haven't even been introduced to yet, just because the situation's so heated when you're walking in. So you always got to be ready.
Yeah, it's tough. I was just going to add, I think a little goes a long way in terms of just even explaining little things. I work mostly in a clinic setting, so I see a lot of patients on an outpatient basis. But I also see a lot of discharge follow-ups, and it's just amazing how much goes on while the patient's in the hospital and doesn't get relayed either back to the patient or back to the family, like test results, and, oh yeah, we did look at this while they were in there, and patients are like, really? I had no clue. So, I always try to keep patients and the family members informed. I think that opens up like a good rapport, but I would agree with your guys' point, like sometimes it is difficult, and, I think we try to do the best that we can, and accommodate
Absolutely.
people. We just hope that everyone's patient, But I do keep in the back of my mind that that is somebody's loved one, and we're doing the best that we can,
And our intention is to do well to the patient. Like that's what we're here for. Like we just want we're only one person, so we want to help everyone. We don't want anything bad to happen to anyone. We want to get you better and out the door, but there's also tons of other patients who also need our attention. So we all just have to work together and do what's best for the patient. So
Do you guys find then that having that experience then makes outside life a lot easier? I mean, your human interactions.
Oh, yeah.
You're just like,
Yeah.
come on, get out of here. Like people could, like I would look at a scenario and go, oh my God, this is a mess, or I'm stressed out, and you're like, psh, stop it. You don't even know.
you'll be fine.
I feel like I'm gonna be the worst parent because of it. My poor kid's gonna be like, "Mom, my arm is broken." I'm like, no, go away.
Put a Band-Aid on
It's
it.
gonna be the worst.
Now, do you guys, so along those lines then, do you have, I try to be good about this. My brother's a veterinarian, and I try to, keep that line in the sand as far as like asking stuff. Do you guys get when you're going out and somebody's like, oh, my arm feels weird?
Yes.
Yeah.
All the time. Yeah, all the time. Your brother is my husband, so he and I get asked probably like multiple times a day, which I want to help people out, but sometimes it's very overwhelming because when you come home from your job that's very stressful, you just kind of want to cut it off and say, I don't want to talk about anything medical, or you're nervous about giving advice to people because you don't want to say like, oh, you'll be fine, like just keep an eye on it, and then something serious happens. Because then you kind of assume responsibility being in the position that you're in. So we always have to be kind of careful of how much advice. Usually it's like, well, you should probably go to the doctor. You should probably go get that checked out, because we really don't want to be responsible if something bad happens to someone that reached out to us to ask us what we think is going on,
And it's definitely different, like people asking you over the phone versus seeing a patient where you can order tests and do things for them versus like, hey, this is what this is, and you're just hearing it and you can't actually see it or do things, and you're like, I don't know what I'm signing myself up for.
Then you have people that send you pictures of like personal areas, and you're like, oh, we could refrain from that. Thank you.
I've seen enough of that this week.
So yeah, I think that's the other thing is like a lot of times if they're family or friends or family members asking you, you don't always necessarily have their chart attached to you, so you don't always know. So it is scary sometimes. Like you try to give the best advice, but
But if it's about me, I'm like, oh my God, I'm dying and all the time. I am the biggest hypochondriac like ever. They will all agree. I think it's just because I've never used to be like this, and I think the more education that I've gotten and the things that you see in the hospital, like I've seen it all. I've seen someone that's like, oh, my back hurt for like a year, and they sent me to physical therapy, and then they have like a metastatic tumor around their spine. That's why I'm crazy, because things like that happen. But so with other people, you're kind of more like, you'll be fine, just go to the doctor. Me, I'm like planning my funeral because I think I'm dying every day.
So with like nurse practicing, is this something that like is like karate, where you have to constantly practice? I mean, where you have to keep up on your education.
Oh, yes.
where you're going.
Oh, yes.
yeah, definitely.
Yeah, I mean, like drugs. I mean, just drugs themselves
right.
change daily. Suddenly, now there's this contraindication to give that, and I mean, you have to be on top of it constantly. And it's really nice. We get a lot of journals and things from your accrediting agency, so they kind of keep you up to date on different things per month. You get little magazines, and it helps a lot. But there's definitely a lot, and it's constant learning. Your schooling is never done.
No. Yeah, things change. Like today, we went over multiple different protocols and things that have changed like in the last 6 months that they want us to change now, and it's just you always have to be on your tip of your toes, because you have to do what's best for the patient. You want to keep up to date on all your care because it's always changing. And I think like the insurance companies, they have a lot of like they're in that they're involved with all the changes too, so you have to make everybody happy with, and we have to keep ourselves educated just because that's our job. That's our job to keep up with the trends and the new treatments and all that. So
I was just going to add, well, even just being cardiology, I have patients that complain of have complaints that aren't necessarily related to cardiology, but could be primary care. And that's initially, that's my background. So like I feel a responsibility to make sure I know and can answer questions. I may not treat what they're, complaining of, but to have that knowledge, you still kind of got to know, so.
So recently I was talking to, because of my job, my day job, I do have clients who are in the medical field. So I interact with physicians and I interact with marketing directors at hospitals and things like that. And so recently I was having a conversation with somebody who's a marketing director from a major hospital in the Chicago area. We were kind of walking, and mostly I was asking from the marketing standpoint. And the question I posed to her was, is there really like a hospital season? And I was really more interested in the marketing, like when they put out marketing. And she took me down this path of like the ER. She was like, well, generally around 4th of July, and then also whenever there's a full moon, we see that. So, I heard a reaction. So I was going to ask you guys.
Honestly, a truth.
Full moon is the truth.
It is. It really is.
So yeah, the full moon for sure. Like, I work in the ICU. We're guaranteed to like fill up with, drug overdose, alcoholics,
A lot of
accidents, psych.
a
The
lot of
full
psych,
moon we have, unfortunately, in our state, we don't really have a lot of funding for the psychiatric patients, and unfortunately, they're not receiving the care that they should from the psychiatric. So they just come out of the woodworks on the full moon, and you gotta be ready to fight because it gets crazy.
I haven't seen a werewolf yet, but I've definitely seen close to it. It is. There's no medical reasoning for why all of a sudden there's a lot of more psych during that time, but there definitely is. There's always a big joke like, oh no, it's a full moon today, I'm working. Like, oh gosh, what are we gonna see tonight? And it's this. I don't know.
Literally, like the last full moon, someone was like dancing naked on their bed, and you're just like, why are you dancing naked on your hospital bed? You're really sick, but it's a full moon, so go get him, tiger.
It's a stereotype, and it's like, but it's honestly a real thing.
And I would say, like, in the winter months, it's more busier, like in the hospital setting.
Illness.
Just illness. There's more
There's
illnesses.
a lot more illness in the winter.
So influenza,
Especially
meaning a
this year.
respiratory flu, not the stomach bug, because I get really...
Well, we had a lot of flu B with stomach bug. Flu
Yeah.
B's been a lot of gastrointestinal.
But there's difference. There is
a difference.
influenza. This is just a public service announcement, because I have like a passion for this.
Stay home.
Influenza
Please.
is the flu, meaning like a respiratory flu. You can have a stomach bug, which is like gastrointestinal symptoms like nausea, vomiting, diarrhea, stomach cramps. So influenza, the respiratory, has been really bad this year. We've lost a lot of patients, young patients, people that weren't healthy. So get your flu shot, people. It's important. And if you don't know,
Vaccinate your
research
kids.
it. Yeah, vaccinate your children too.
Whatever moron decided that was not a thing. Oh my gosh, I'm sorry.
We just see it, so that's why we're
do,
so
we do.
opinionated about, because we see people who don't.
I'm not getting paid by any drug companies.
No.
I'm not getting extra money for saying
Yeah, we do
this.
not get
I
reimbursed.
truly believe. Please vaccinate your children.
Yeah. And the flu shot is important. And I know people have said that, oh, it's only like 20% effective or 40%. That was like based off of stats from Australia. So the flu shot was actually more effective than the public was notified by the news. But it's never...
It also shortens your symptom duration.
Yeah.
If it doesn't cover 100%, it still shortens... You still have some immunity to the virus, so you do have shortened symptoms and you have lesser symptoms than people that weren't vaccinated.
Yeah. And some protection is better than no protection. I'm
Yes.
just saying. That goes for multiple things.
Condoms.
Sorry, Mom.
So do you guys now, with where you're at with your nurse practitioner degrees, do you have a favorite part of your job now? Because you came from a certain area and now you're in this new area. Is there one aspect? I know you picked cardiology. So is that, is there some aspect of that you like better than where you were before? Or?
I will say I do like having one focus, which I think could go both ways, but for me it seems to have worked. I like focusing on cardiology. I think what was different for me is working in an office setting, like in a clinic setting, because I had strictly been in the hospital most of my career. So that was kind of different, and I didn't know how much I would really like it being in the office. But honestly, I've turned out to like it more because now I've started rounding in the hospitals, and I actually can honestly say I kind of like my clinic in the office better because I feel I have more control. I feel like I am kind of a little bit more personable with my patients. I can sit there, I can talk to them. I have follow-ups with that. Like a lot of my patients I've seen, I'm like, I need you to come back in a couple weeks because we need to check on this. And so I like having that rapport and that follow-up and kind of keeping tabs on patients. Like, they're my patients that I'm, watching out over. So that I like. But
I just like the paychecks.
I like that we have more free reign to like make our own decisions.
Yeah.
I mean, especially being in ER, I pretty much see my own patients unless I have like a specific question for the doctors. I mean, I make every decision that happens. Like I get to choose what tests, what drugs they're going to go home on, what drugs they get in the hospital. And it's definitely, I feel definitely more responsible. And I mean, even as an ER nurse, like different things, but you don't get to order everything. You don't get to dictate the care. But as a nurse practitioner, you get to make these decisions. And I don't know, it's just more validating.
Yeah.
I'm using my education. That's what I feel.
Absolutely.
Right.
And I work in the same field that I worked as a nurse in. I was an ICU nurse, basically since 2011. So that's all I really know. When I was in nurse practitioner school, I was like, when I get out, I'm going to work at CVS and I'm going to have a cush job and I'm going to diagnose ear infections and strep throat and like call it a day. Well, my crazy self, I'm like, I can't get out of this. Like, I had an opportunity to work with an intensivist group, and I wasn't ready to give up critical care. Like, I would never be able to do this job in the future if I didn't take it now. Because I'm family practice, so I should be practicing in primary care, cardiology, in the minute clinics, but I took the critical care role because usually like acute care nurse practitioners work in critical care.
Right.
But given my experience, and that's what helps, and I think that all people who are interested in pursuing their higher education in nursing, you should get your experience first.
I would agree.
Test out
sure.
the nursing field. At 21 years old or however you are old when you graduate, you don't know what you want. You don't know what you want to do. Got to test out all the fields, see what you want. And I knew I liked critical care and I knew I wanted more. And I'm grateful for the job that I have. And I have it because of my experience as an ICU nurse all those years. So that's why I qualified for my job. So I love the craziness.
Do you guys feel that doing the careers that you did have helped you figure out more of who you are as a person? Meaning, like, you've had to kind of cut away and go, this is
Yes,
now
I'm totally jaded.
I just confirmed it.
It's confirmed. 100%. No, I mean, like kind of like we talked about before, like you have to cut yourself off at some point. There's definitely that emotional component that you have to like shut yourself down for. I mean, you have to make people's decisions for their medical care. I mean, it's not like, oh, if I mess this up, like we'll just try something different tomorrow, or we can go back into Word and edit this document. I mean, it's definitely something like, okay, if I do this, this could happen. If I do that, this could happen. And what is the best for the patient? And it's definitely, I mean, no one goes in this field being like, oh, how can I harm someone? You want to do the best you can. I mean, you go home and go, oh my gosh, did I make the right decision? Did I do this? And sometimes you just have to like trust yourself and trust your gut. And it's definitely a different career path than some other jobs for sure.
I feel like a different person now that I'm like kind of more, I've like 6 months in and I feel, or a little bit more than 6 months, but I feel more confident.
Oh, for sure.
Like I never thought I would be at this point, but you kind of get put in a role and someone comes up to you and they're like, this patient's crashing, they have no blood pressure, they're not breathing very well. Like, what do you want me to do? Whereas like a nurse, we were like, hey, like, this is what's going on with our patient. Like, what do you want us to do? Like, do you want me to intubate the patient? Do you want me to do this? And you were making suggestions, but it wasn't your call at the end of the day. So, you know, we have to make that decision. And in the beginning, you're like, oh my God, I don't know what I'm doing. I don't want to say the wrong thing. You know, it's hard to adjust to our new role because it is different than nursing. But now we're starting to kind of get more comfortable. We still have a lot to learn, but I just feel like a more confident woman. Like, I'm just like, I feel proud of myself for pursuing a higher education, and I feel more confident, and I'm proud of all my friends for going back to school and being boss ladies.
Right? No.
Well, you talked about the, you know, feeling and having the responsibility of it. Are there still, this is just me being naive, are there still perceptions that people have about your jobs?
Oh,
that,
for sure.
Yes.
Like,
Yes.
what are some of those things?
Trust.
Trust. Yeah.
Yeah.
Well,
I
we
mean,
were
even-
just talking
even
about this
our
earlier.
role. I mean, I feel
Yeah.
like a lot of people don't understand the role of a nurse practitioner. I'll come in the room and they're like, either, oh, the nurse is here, or, oh, the doctor's here.
Yeah.
It's
Yeah.
never like, well, I'm like, well, I'm your nurse practitioner, and you try it, and they're like, so you're a doctor, and I'm like,
Yeah.
At some point you're just kind of like, and I don't ever claim to be a doctor. I mean, I didn't do all the residency. I'm not trying to be that person.
Sure.
But you're like, fine, I'm your doctor.
Yeah, they see the white
There's,
coat.
like, there's
they see the
definitely-
white coat, and they assume
It's one extreme or the other.
And as a nurse, I used to get so mad at either the PAs or the NPs where they would come in the room and the patient would call them doctor and they would never correct them. And I'm like, you need to correct them because you are not a doctor. But now being in that position, we hear it all the time. Like Tegan said, it's like, oh, thank you, doctor, thank you. And you correct them, but then it gets to the point where like I cannot correct them anymore.
Or they're just kind of like they just don't understand. They're just
Yeah.
like, whatever.
Yeah.
They just give up, so they just call us doctor, and we just give up because we're like, we don't know how else to tell you.
I think people are learning more now.
Yeah.
Like nurse practitioners, I mean, it's booming. Like everybody's going
Yeah.
back to school. All the physicians have nurse practitioners or physician's assistants. Everybody wants them because, you know, the influx of patients that we have to see. Everybody has health insurance now, so we are taking that load off of the physicians. They can go see more critical patients, or we can double their workload by like giving our help and our assistance, so more patients can be seen. But I still think there's some patients that they don't know about nurse practitioners, or they're still like stuck in that, like, you know, I want to see the doctor. You know, we were just talking about that.
Yeah.
Like we know what we're capable of. We have been a nurse for a long time, and then now we're a nurse practitioner. We have a higher education, and we're able to provide. We listen. We spend so much time with these patients. We're not saying doctors don't spend time with their patients, but just the nurse in us, we're very inquisitive, and we want to learn. And I think if people just gave us a chance, they would prefer us because we're great.
Well, Amy actually had, I'm sorry I interrupted. Amy actually had orthopedic visits for her shoulder, and a majority of the time the person that she saw was a male nurse practitioner. So, and he generally, we felt like he knew more than the physician, probably because he's there most of the time dealing with people.
And we're just
No, we
that's just what we're brought up doing. Like we're
Right. We
so
just came from a different background.
Yeah.
And we definitely have that nurse in us still. And we're more compassionate. We're definitely more, we've been on the front lines with you guys. We've taken care of you guys in the hospitals, and we know what it is to be a patient. You know, we're not just coming in, signing your chart and leaving. I mean, we spend time with these patients, and now as a nurse practitioner, we don't get to spend as much time as we'd like, but we definitely still have that background, and we want to help our patients, and we want to be there for them and take care of them as a full person. And we do that, I feel like, a little bit better than some doctors, and sometimes, and even some PAs, sometimes we do better.
yeah.
I'm allowed
have
a little bit longer appointment times than the doctors that I work with. And I think that, one, because I'm a nurse practitioner, but two, I think because like I have the capability of like sitting there and, you know, just like making patients feel like they're heard and, you know, can explain and
It
talk
changes
about what they want to
everything
talk.
with them.
Yeah.
I mean, and they feel like we validate them
Yeah.
more when we are able to spend a few extra more minutes. I mean, even if it takes another 3 minutes just to go, tell me how is it going? What else
Yeah.
is going on in your life? And they're kind of like, oh, this person actually cares, rather than just like, okay, well, you've had your 15 minutes, next appointment.
Yeah, no, I've had a couple of patients I've seen in the office, actually, a number of them that have like either complimented me or they've like, you actually spent a lot of time with me, you answered a lot of questions, or you explained this, nobody ever explained this to me. And for follow-up, they've actually like requested to just come back and see me in 6 months. And, I do to an extent, depending on whichever doctor they normally see, but I mean, it's a nice feeling, and I always tell my patients, like, if you need anything, you can always call, like, I call patients back myself if I want to, if I have something to tell them or something to update them with. And I don't know, I just think it's like a little, I'm not at all, like, I have so much respect for doctors, but I just don't think that they have the time that,
Right.
we're
Absolutely.
able to
They're definitely
give.
seeing more critical than we are.
Yeah,
and we get to spend a little bit more time, and it's nice.
And include, like, as nurses, you teach, like, that's your job. Like, when you discharge a patient and they have all these new meds, you go over all the meds, this is when you take your meds, and that's part of us too. Like, we can sit here and tell you, like, we diagnosed you with this, we're going to treat you with this, and we want you to follow back at this time. But we are also responsible for making sure you understand what we're telling you. Because sometimes patients are like, yeah, I understand. And then they don't understand. They don't take their medications like they should, or they take it inappropriately. And then, we're back to square one. So we want to make sure, like, you're understanding what we're trying to accomplish, our
Why
goals
you're
of
doing-
care. Why we're doing
Sometimes
that. So we're all on the
that
same
just
page.
Yeah.
Because we don't want you to come back. I mean, we don't want you to have to come back into the hospital, be readmitted, have more issues. We don't want to waste your time. We want to get you better and get you on your way. So,
So, yeah, just a few extra minutes to be like, so this is why we're doing this. And sometimes patients go, oh, no one ever told me that before, and now this makes sense. And, I mean, patients aren't stupid. I mean, they're not. I mean, there's so much information, especially people go online and go, hey, I saw this and this and this, and they want to be educated about their healthcare, and sometimes just to be like, so we're going to do this is what you have, and this is why we're doing what we're doing. Sometimes they're like, oh, okay, and they want to follow through with the care you're providing them because they understand the reasoning why you're doing this, not just, here, take this pill to make you feel better.
exactly.
Yeah, I mean, recently I had an annual checkup, and that was one of the things I got sent right away, probably a day or so after, was a survey that I had to take. And a lot of it was like, how long did you wait between checking in and this? And was the person at the desk courteous to you? And then it was, how did you feel like you were informed when you had to wait for the physician? And it was all this stuff about just checking up on how my experience was.
Well, and that's what healthcare is. I mean, you can pick and choose where you want to go. Like, and that's why all these hospitals, they're building these great big, like, state of the art, like, facilities, and you're like, that hospital looks beautiful, I want to go there. You could pick and choose where you go, and if you don't have a good experience, you're gonna be like, okay, I'm not going to follow up with this person because I had to wait 5 hours to see someone and they were rude to me. So it's all about patient satisfaction and good
Which is
and
a
good
plus
care.
and minus.
Yeah, plus and minus. Yeah, for sure.
There's a lot of political stuff behind that, and there's a lot of reimbursement issues behind that, which I don't completely agree with, but
We're never going to change that.
it's never going to
unfortunately.
change that. So we're not even going to go down that road.
So we are going to get to the myths shortly, where I'm going to ask you guys, I'm going to say the things and then have you guys respond to them. You can abstain if you don't want to answer them. But one question I have to talk, because we've been so serious now, is I have to ask, what are your guys' opinions on TV medical dramas?
Oh, God. First off, let's talk about This Is Us.
I sleep with every doctor I obviously.
So it is true.
So, well, no. First off, we need to talk about This Is Us because Jack. Do you watch This Is Us?
Wait, I haven't seen the second
never
season,
even
so I don't
seen
know how
this.
much you can talk
Well,
about.
let me just say they coded him for about 20 seconds.
He codes.
Yeah.
Oh, I can't be a part of this.
Yeah,
conversation.
he's like smoking inhalation. I'm sorry if there's any spoilers. I mean, this is like 6 months ago.
Crock pots are out.
But
I knew he died, so it's okay. You can go on.
No, I critique like when they have
Spoiler
like a a Yankar like in the patient's mouth. Like a Yankar is like a suction device, and they'll like tape it to the patient's mouth in the TV drama and use it as like a breathing tube for a ventilator. I'm like, what are they doing? That's obviously a suction catheter in this patient's mouth, you know?
Or they're shocking on a flat line. They're like,
Yeah.
You're like, no, you cannot shock asystole.
Nope. You're like, oh,
You know
come
what
on.
though? I do think that and like the what is it? I don't know if it's TLC or whatever. Where they do show like the actual like realistic shows like New York Med and things like that. I think that that's good TV because I think that that's real. You know, like just like code situations. Like every code situation. I mean, no code situation is like beautiful. You know, I mean, there's crap everywhere. There's, you know, I mean, it's a mess.
Right.
And a lot of times, like I think patients, you know, our family members may kind of not have the real perspective as to like what actually really goes on during a
They're
code.
like, but
and,
on Grey's Anatomy, this is what they did.
yeah,
and you're like,
it's
listen,
not like that.
we're not going to treat your family member like Grey's Anatomy, okay? Because they did not consult with the
Want us to
medical.
treat your family like Grey's Anatomy.
Please do not reference Grey's Anatomy for your loved one's medical condition.
Or WebMD.
But I think that TV shows, like, they really need to reach out to medical providers. Like, I would be happy to consult someone on a medical show. Like, this is how we do it in the real world. I know they can't do the perfect, you know, depiction of a case, but we should be more realistic, you know, especially when the public, that's all we watch, and they grab onto that stuff. So we should make it more real.
I do think Grey's Anatomy is a good show, though.
Yeah, but
I don't know. I can't really talk. I haven't watched it
I
in a
mean,
while, but-
people do hook up in hospitals. I mean, it
Yeah.
does happen. It does happen.
But really, in general.
And let's start the
Tegan?
podcast here.
We have lots of stories, but we will refrain. Plus, we've been drinking wine.
So, care to share any story? Well, not about hooking up in hospitals, but any stories you can share, either bizarre instances. You already mentioned somebody dancing naked on a thing during a full moon. I'm sure there's so many, but
There's so many. Yeah, I don't even know where to start.
Well, going back to the flu shot, this was like a recent
Okay.
funny one. Is I had a patient who I asked him like, "Hey, do you get the flu shot? Did you get it this year?" And he's like, "Of course I did not get the flu shot. That is how the government injects trackers into us." And I'm like looking at him like, the government injects trackers into us from our flu shots. But he was serious.
And we all carry around cell phones.
Yeah.
It's where the government is tracking us.
so you were like talking into your lapel then? You're like,
Yeah,
he's onto
like-
us.
Trump, he's onto us. No, seriously, I wish I could write a book on like everything that people have said to us or what we've
Oh, I've
seen.
actually written stuff down. Like, I mean, obviously not patients' names or any identifying things, but
Yeah.
I've like written things down before. And I'm like, one of these days, I'm just
Yeah.
going to make a book, and everyone's gonna think we're making this stuff up. But I mean, honestly, sometimes I just can't make this shit up.
Yeah. No, for real.
Yeah.
It's people aren't afraid to say anything to you. Like when I was a nurse, I would have little old men that'd be like, "Can you hold my urinal for me? And then can you crawl into bed and cuddle with me?" And you're like, "No, sir. I'm so sorry. That's not in my job description." But people hit on you when you're in nursing or whatever, and you just kind of have to look past it. And people act crazy, and we have people who abuse drugs and alcohol, people who detox from alcohol. That is never a happy scenario. We've been spit on, hit, like cussed out. I got thrown into a wall once by a family member when I first started nursing. So there are no limits. We have plenty of stories. But unfortunately, due to HIPAA,
There's no privacy. I mean, I'm definitely things that normal people would be like, "Oh my god!" I'm like, "Oh yeah, we should have come to work the other day and seen this." There's never any like personal space anymore. It's just all like,
we've
yeah,
seen
whatever.
a lot of private parts.
Yep. I feel like it's half my job description. Take a look at this. How every story starts.
Yep.
Now, have you guys seen any trends is a terrible word to use with regard to this, but either things that you've seen are kind of coming in a wave. You mentioned the flu, but either addictions or other things that are like, I don't want to say what's trending right now,
No,
but
I mean, there's definitely different areas. I mean, I did travel nursing for a while, so
Yeah.
I've traveled different places in the country. I went to North Carolina, I've gone to Texas, I've been to Phoenix, and there's definitely different areas where different things are definitely more prevalent. There was a lot of more drug abuse in different places. There's a lot more like psych. I mean, some of it had to do with just being military bases being close by. That seemed to be a lot more psych and things like that, as a trend would be per se. So
I'd
it's
say in
definitely
our area, we have a lot of heroin,
Yeah.
ODs. And you would think, like, we live in a pretty nice area, and you would think, like, drugs and alcohol, that really wouldn't be a big topic or a trend. But honestly, that a lot of our patients abuse alcohol, abuse drugs, as we're drinking wine. But no, and it is really sad. But that's a big, especially with our younger, male population. We have a lot of patients
a lot
who
of heroin overdose.
yeah, a lot, especially in this area. A lot of suicide attempts, we get those regularly, which you don't want you don't want to see those kind of patients. Not that you don't want to see them, it's just you don't want that to be happening. You don't want that to be the trend,
And I think that's got to be, for lack of a better term, interesting because so many people don't know that. You know what I mean? It's like only recently have I started like reading it up on the local paper in my town, and it's like occasionally they'll drop in a little story about somebody gets something for possession or they do whatever. It's not necessarily about the medical portion of it, but when you actually hear things that are going on that you experience in the hospitals, I mean, I imagine at first when you first come across something like that, being a nurse, you're like, what? And then you just kind of over time, get used to it. But it's you definitely have a unique perspective because you're exposed to it more than the average person.
Right. I mean, one of my biggest trends, I mean, I work at a little bit more of a lower income hospital, and we get a lot of people that come in for pregnancy checks, a lot of people for STD checks, and I mean, for a story, I mean, the other day I had this young girl, I mean, she was 17, and she wanted to be checked for STDs, she wanted to check for pregnancy, and I asked her, I'm like, are you trying to get pregnant? And she's like, well, my guy wants me to get pregnant. So I asked her, I'm like, well, do you want to get pregnant? And she's like, it doesn't matter. And I looked at her and I was like, you're this person's mother for the rest of your life if you get pregnant. I'm like, this is a big decision for you to make at 17 years old. And she just kind of like looked at me like, this is the norm, and we get a lot of it, and it's not a place I grew up by any means, and I kind of like, I couldn't imagine having a kid or being like, oh, this is like an indifferent thing for me at 17, and I don't think she liked me for questioning her. She wasn't very happy about it, but I hope maybe one of these days she kind of looks and goes, well, maybe she was right, and I hope I gave her a different perspective to think about at least, if nothing else, but there's a lot of other things besides for drugs and alcohol. I mean, there's a lot of STD things we see daily and people getting checked, and I'm like, well, there's certain things we can treat you for, but there's also a lot of things we cannot. And people think that, oh, I'm not going to use protection because I don't care if I get pregnant, but I'm like, you can also get STDs that you're going to have the rest of your life, and there's definitely a lot of that kind of stuff that needs to be checked by the public as well, I mean,
and that goes back to our job to educate, because a lot of these areas, and that's where a lot of nurse practitioners are needed, is in the lower socioeconomic areas where they don't know. I mean, they don't know any better because they have a knowledge deficit in that, and that's our job to.
Or it's their norm for where they've come from.
Right.
And it's just a totally different world to see, and sometimes it's just. You want to help them, and you want to tell them. I mean, I'm not saying that whether she had a baby is right or wrong. That's her decision, But I mean, for the STD portion of it, it's like I don't want you to have something that you can't ever get rid of the rest of your life. I mean, you can contract herpes or AIDS or something that.
And it's life changing.
Yeah, that's life changing, and that's not like, oh well, if I just take this pill, it's gonna go away.
Right.
That's got to be a hard part. You talked about kind of, well, you can get in this thing and you can kind of wall off some things, and then you can check down your list of things in order to help give care. But that it's got to be hard sometimes when you see somebody either repeat and come in and you're like,
Right.
what are you doing? When you just want to slap them upside the head and be like,
I mean, we get that all. I mean, we get that all the time when people they're
I
non-compliant.
was just gonna say.
Non-compliance is huge, and it's like they come in, they're on death's door. You fix them for the time being. They say they're going to be compliant, take their medications. They go home. They don't take their meds, or they continue smoking, they continue drinking, they continue doing drugs or whatever. They just don't want to take their meds, and then they come right back to the hospital, and you start right from square one. And it does get frustrating because, I mean, some patients, they have excuses like they can't afford their medications, and that's something that we try to do our best in trying to find them affordable pharmacies to get their medicine from and try to offer them as much assistance as possible. But there's also some people that just don't care, and it's hard to keep seeing them come in and in and in because it's frustrating for us because it's like, what are we doing here? Like, do you want help or not? You know, because we keep fixing what you keep on doing, you know. So it is very frustrating sometimes.
I read a story recently, it was probably a couple weeks ago, where a guy actually like OD'd on heroin 3 times in a day. He OD'd and then they came out and saved him, and then he like had some other thing go on. It was like a really bad day. I mean, it was probably over a 24-hour period, but it was
At that point,
being
it's
in
like
ER, I've seen that we've had a patient that we've OD'd on heroin, and we give them the reversal medication. And they wake up and they're pissed. I mean, this one guy specifically was angry. He's like, I can't believe you just took my high away. I mean, in other words, he was swearing at us, and I spent all the rest of my money I had in my savings account, and you just stole my high from me. And we're like, sir, you were dead. And he's like, he didn't care. I mean, it was just, the addiction part is definitely a big factor, but it was like, these people don't understand. Like, sir, you literally were not breathing. Like,
that's the worst when you do that. When we give Narcan to patients who are like heroin overdoses or opioid overdoses, like Norco, Vicodin, you know, whatever. We give them Narcan, which is a reversal agent, and they go crazy because you go from like dead to being completely obtunded, like not responsive, to like these people are cats on hot tin roofs, like they're angry because you were, like Tegan said, you totally reversed their high, you know. So, but you had to do it because they weren't doing well, you know, and you got to reverse that.
With the story
OD'd.
you were saying, I'd be more worried about an underlying psych component. I'm like, why is this person the third time going home? If they come back a second time,
That's
I'd
a
be
bad
like,
day.
I'd be like, all right, you're being held because obviously something else is going on, and why are you doing this? I mean,
And this is attention seeking at this point. You know what I mean? Like, why do you keep doing this?
I would say more a psych component.
Yeah,
than
well,
a
for sure,
attention
100%.
thing. I'd be like, are you trying to kill yourself? Like, what's
Yeah.
going on here? If you come back now at least twice, I'd be like, who's sending this person home? I've already OD'd twice today. Come on, like, there's
We need
something
to
else
admit
going on.
this person.
Right.
From what I read in the story, it was like he went to different treatment location. Like somehow he was in one location,
okay,
did it.
okay.
He
and
probably
they
signed out AMA.
walked
Or
out,
signed-
and then
that-
he went
That's
somewhere
my
else.
favorite AMA sign outs.
Yeah.
When they're like, I'm leaving, like you get them just enough better, and these people are not well enough to leave, and they sign out. They sign out against medical advice. They sign a paper, or sometimes they don't sign a paper because they're so
Or they just
angry,
walk out, yeah.
and their butts flapping in the wind because they don't even have clothes to put on. But usually with those patients, you can't change their mind, so they know the consequences of leaving the hospital at that time. So.
Now, do you guys mentor anybody? This is me being naive, but do you guys get, like teachers will get student teachers? Do you guys get new nurses in that either shadow or things like that as part of your jobs?
Not yet.
Not
I was gonna
yet.
say I don't think at this point.
Yeah,
Yeah.
I think because we're still so fresh,
Uh-huh.
I would love,
Yeah.
and once I get more comfortable in my role, I would love to take students.
Yeah,
we
I have a friend who's a few semesters behind, and she's starting to start her clinical stuff, and I told her I would take her. eventually. I mean, I'm actually really excited about doing it, and I would love to.
We like spreading. I mean, when we were just nurses, I shouldn't say just nurses. When we were registered nurses, we all took students, and I loved having students, and because it can be a really intimidating experience for novice nurses, but I would love to take students in the future. And we mentor our friends, though. We have a lot of friends who are going back to school, and I mean, we've all lived it, and you want to try to make their experience as easy as possible and kind of ease their minds, because we've all had many breakdowns while in school.
We've all
so
been there.
yeah.
And so anyone who's in the medical field, take students, please.
Yes.
Because that's hard. That's
to learn.
That's a
and-
big thing with the NP programs, that finding clinical sites is very difficult. Like, you literally have to call these physician offices, offices in general, and beg for them to take you. And you need to have a certain amount of hours to graduate. But that's probably the hardest part of our program, is finding people to precept you, to teach you. And people don't want to do it because you don't get paid. This is something that you have to volunteer to do, but you have to think, like, this is the future. You have to give back because you were there.
The payment's going to come in when people are able to help you in your office.
Yeah.
It may not be a physically paid job at that point, but at some point in your future, this may be beneficial to you, and we need this education, and we want to learn. We truly do. We're there to learn, and we want to. And for people to be like, no, we don't want a student. Like, yeah, we're a little bit extra work. Yeah, maybe you have to take 5-10 extra minutes to teach us something or show us something new, but it'll be more beneficial later when you're like, hey, maybe I should hire this person because I need help in my office.
I was hired in an office that I precepted in. So, and
Same
it was,
here.
Yeah, it was my last clinical semester, and they had just got a new computer system, and I learned the computer system. And so I think when they decided to hire me, it was kind of like, it kind of had like a little bit of an in,
Right. Yep.
So,
this is a question I kind of like posed to Kate before, but I wanted to ask if somebody was interested. Now this sounds like a radio show, but if somebody's interested in becoming a nurse practitioner, what's either the advice you give them, or where should they look, or things like that?
First and foremost,
Yeah.
you need experience as a nurse. There's so many people that I've had personal interactions with that are like, I just graduated nursing school and I'm going right into NP.
no.
That is a bad decision. That's
Yes,
bad.
I
Because if
agree.
you think about it, physicians, they go 4 years med school, and then they do 4 years of a residency. And then if they want to specialize, they do like a 3-year fellowship. So it's not like they graduate from med school and then they just start becoming doctors. There's a big period of time in there that they're learning still. Nurse practitioner, you go to school, if you go full-time, 2.5, 3 years. And then you have a year of clinicals. We did, four semesters of 150 hours. So 600 hours of clinicals. And then you're off on your own. You're practicing, you're making decisions. And if have no nursing experience, that's
Right.
scary.
The nursing aspect, you learn to, just something as simple as like assessing your patient. You definitely learn more assessment when you go back to being NP, but doing the assessment, passing the meds, knowing what different meds interact in different ways, knowing what you need to look for when you give a med. If you don't have any nursing experience and you just go straight from nursing school to nurse practitioner, like, you don't have these life experiences. And it's definitely something that I'm so glad I didn't go right into, because there's definitely things now I'm like, people come in and go, oh yeah, I'm on that medicine that starts with an L, and you're like, lisinopril, and they're like, oh yeah, that's it, and it's like, you don't know these things until you've had these experiences and gone through different things. And I definitely would say, don't jump right in. Kate's 100% right. Don't jump right in.
And it's not like, we've been there. Like, we've been through this whole program. So that's why I get frustrated too, because like, I've gone through CNA. I got my associates in nursing. I got my bachelor's in nursing. And then I got my MSN. I've been through me and Tegan both.
Together.
Lindsay's the overachiever and just had her bachelor's right away.
Whatever.
What a smarty pants. But, I've been there, done that. So, I think we're good resources to say like, listen, this is the route you should take to be successful. Because when we graduated, we all had multiple job offers.
Yep.
You know, because physicians are familiar with us. We work besides physicians. They trust us, you know, and that means a lot. And, you know, like Tegan said, you got to know your meds. You got to know how to talk to people.
Yeah.
As a nurse, you walk into a room every day and you have to gain their trust. You have to introduce yourself to a stranger. Hi, I'm Kate. I'm going to be your nurse today. And there's families staring at you. They don't know who you are. They don't know what you're capable of. They just want you to take good care of their loved one. So you have to establish that trust right away. And that's hard, you know.
Yeah.
Not anybody from off the street can't just go in there and be like...
a lot of people are afraid for their family members.
Yeah.
So they're like, initially, like, they're judging you. Like, you better know what you're
Gonna
doing.
say, just the nurse practitioner role itself, a lot of people have hesitancy, you know what I
Right.
mean? But
You got to prove yourself right
yeah,
away, you know.
and I look at where I was a nurse when I first graduated to like where I am now. I'm about 9 years. I mean,
Yeah.
I think I'm a better nurse now than, you know,
For
For sure,
100%.
yeah.
Yeah,
I'm not saying any nurses out there not to
No.
do this. I mean, for any reason, but definitely get some experience behind you
Yeah.
before you do this, so you have a background and be like, oh, I've seen this before, or I've done this before, and you at least have a field to kind of guide you in the right direction.
And that's my practice today. I would say like 75% of what I know and how I practice is based off of my experience as a critical care nurse.
Yeah, I agree.
You know, and then the 25% is kind of what I've learned. I've learned how to make, you know, do consultations and how to talk to families from a provider point of view and in different order sets to put in and all that stuff. But my foundation is so strong because of my experience as a nurse.
I agree 100%.
On a lighter level than that, I shared the same feeling in that earlier in my life, much earlier in my life, I went and worked at my dad's animal hospital, but was like cleaning kennels and doing all this stuff there. And I used to say all the time, I was like, before you say I want to become a veterinarian, you need to go in there and clean the kennels. Because,
true. No,
or
it's true.
because you have this perception of what you think it's going to be a veterinarian, but the glamour is not always there. And
Right,
so,
and actually, in the same kind of role. I mean, as a provider now, like I feel like I respect what the nurses and what the nurse assistants
Absolutely.
and everyone below you, so to speak. I know it's a horrible word. That's not what I mean by any means, but like the people that are
at the bedside.
like at the bedside that are whatever orders you're signing off that they're going to do, you know, to help your patient. You know, I mean, like. You have so much more respect for them because you've been in those roles. I mean, as Kate said, like she was a CNA first. I mean, we all were, obviously.
yeah.
We all, that's where we started. I mean, we've all wiped butts and cleaned beds and
And you
given
know,
baths.
when you're putting in orders and you're asking for things from the nurses, you like put yourself
respect,
in.
yeah.
You put yourself in their shoes. You're like, how
respect
what
what
would
they're
I
doing.
expect out of this provider if I was the nurse? And that's how I am. And I think you get more respect that way. Like, you know, I'll be in the nurses or I'll be in the patient rooms and they'll like look out in the hallway and be like, hey, can someone help me with a turn? I'm like, I can help you with a turn. Like,
Right.
Like I know how it is. Like I'm not, just because I'm a nurse practitioner now doesn't mean I know how it is to find someone to try to help you reposition a patient. And I will be more than happy because let me tell you, you got to make those nurses happy because they make your job a lot
Right.
easier.
No, I mean, nurses are like the foundation for everything that goes
yeah.
on in the hospitals. I mean, anywhere really. I mean,
they coordinate
do.
all the
They
care.
do everything, and they care for your patients, and they're the ones that are actually doing the orders you're putting out and taking care of for your patients. You know, and I mean, I've been there. We've all been there. We've been doing this blood needs to be drawn at this time. This med needs to be given at this time. And you know, now that I'm putting in these orders, I'm like, all right, how can I make my nurse's life easier
Yeah.
too? Because I'm like, oh my gosh, or I'll even in the ER, like I'm like, oh my gosh, I'm so sorry. I know I'm making you walk into this person's room. I just ordered this med, and then an hour later I'm ordering this med, and I'm
Yeah.
like, I'm so sorry. I'm trying not to be that person, but
Sure.
this came up. But I mean, I respect my nurses because I know what they do. I've been there, and I mean, I feel it makes me a better provider because I was a nurse first.
I think that's what like sets us apart from physician assistants. Like I know a lot of people always say like what's the difference between an advanced practice nurse, a nurse practitioner versus a PA. And not to discredit the PAs because I think the PAs are great. They are here to serve the same purposes as us, but what sets us apart is really our prior experience as a nurse. It's our background because you could be, I mean, a major in musical theater and then go to be a physician's assistant. So that's what kind of puts us a little ahead of the game is like we have so much prior experience. We relate to those nurses and I think we're assets because it's like I've been in your shoes and I know what you're going through and our job, like we just need to do what's best for the patient. You know, we have to be patient advocates. So we're just badass.
All right, so now, if you guys are game,
Uh-oh.
I'm going to read through my list of home remedies and have you guys
remedies.
respond.
Let me chug my wine real quick.
Home remedies.
All right. I'll throw one out here and just see how you guys respond. Put butter on a burn.
No.
Oh my God.
No, please don't. It's like adding oil to a fire. Literally.
I've never
No.
heard that before though.
Really?
But I don't.
heard of it,
Oh my gosh,
but-
yes. No, I hear that all the time. Like, oh, we did this. And you're like, why?
I mean, it sounds like a bad idea. I wouldn't do it, but
Are you trying to make grilled cheese? Or, I don't know what we're doing. What's our accomplished thing here? Like, oh,
All right, the next one. Throw your head back to stop a nosebleed.
no.
no.
Supposed to pinch it and lean forward.
Pinch it above your sinuses.
Yep.
I mean, throwing your head back is
'Cause of
just
the-
going to be a bunch of blood pouring down your throat into your stomach, and then you're going to throw up blood. And you're not literally throwing up blood from your stomach. You're throwing up blood from the blood in your nose going into your stomach.
That sounds
And
like
you're
you've had
not.
experience.
No, not at all. No.
like, I've just seen
No, I
it.
had a bloody. No, we get this. Come in for. Oh, I'm throwing up blood. Well, have you had a bloody nose? Yeah. Well, there you go.
We solved your problem.
Guess what? you had a nosebleed that you swallowed blood. Sorry, keep going. Okay.
No, so all right, so the next one, which some of these, like I said, as I'm going through them, I'm like, yeah, don't do that. But I wanted to read them off just to get your responses. So, if something gets stuck in your flesh, pulling it out is okay.
Depending on what is stuck in your flesh.
Yeah, no, I mean, a lot of times, literally, wounds heal from the inside out. So a lot of times, even if there's something in there, your body pushes it out eventually. Like, I mean,
Now, if
pull
you
it out.
like
If
shot
it's-
a nail through your hand or something,
Uh-huh.
you should probably be careful.
If it's in your flesh, yes. If it's like through your body,
Oh, if it's
no.
in deep,
I mean,
right,
like,
yeah.
if you're talking about
Yeah.
like, oh, I stapled
An
my
arrow
finger on or
through-
pull a staple out versus, oh, I stuck a knife through my hand.
Yeah.
Those are two definitely.
then we
different
worry
through
about
the
like
flesh.
your arterial bleeds
right.
or whatever.
Like, oh, I was in a
Immediate
car accident and there's a
tetanus.
hole through my shoulder. Like, yeah, no, don't pull that out.
yeah.
Seek a doctor. It's beyond my pay grade.
Put vinegar compresses on a sunburn.
Yeah.
That sounds painful.
Yeah.
I would not do that. I mean, I've never heard either which way, but
Aloe
Yeah, I'm
or
not sure.
bacitracin.
yeah.
Yeah,
That's
it
what I'm
sounds to me
recommending.
more like that would be a
Painful.
irritant.
Yeah,
than
it's like-
anything.
That would be like
Maybe
a,
people
that
think
would be
it's-
like a
acidic.
right.
Kelly
a burn?
Clarkson moment, like Kelly Clarkson, you
What?
know, from the movie 40-Year-Old Version when he gets whacked.
I was like, what? It's a Kelly Clarkson moment.
Is this American Idol?
I was like, like, what did she sing about this? 'Cause I don't remember.
Vinegar and sunburn. That sounds
It's like a new song.
it's
All right,
number
Kelly.
one on iTunes.
We get some money for any profit you make off that song.
This one, you need to get the venom out of a snake bite as soon as possible.
Yes.
Yeah, I would imagine
100%.
so. That's not in our area. We
I
don't
know,
really
it's
deal
not really,
with.
yeah.
That's in my area.
Is it?
Oh, hell yeah. Hell yeah. I'm ER, girl. What do you mean? In my
Well,
area?
I mean,
No.
we're not like Arizona or
Well,
something.
But I was. I
yeah.
learned, okay, when I did travel nursing, I learned more about snake bites and scorpion stings when I lived in Arizona than I ever thought. I mean, I was kind of under the impression as like a Midwesterner, like, oh, if you are hiking and you come across a scorpion, don't mess with it. no, like these things are like in people's houses like spiders. They say to like put baby cribs, like the legs in jars so that scorpions can't climb up like your baby crib and sting your babies. Like,
Really?
like for real, yeah.
Wow.
So I mean, we have
Maybe
like
I won't move to Arizona.
right? No, I mean, there's definitely you can spray for them and all this stuff. But I learned so much about like scorpion and snake bites like when I was there. But you definitely want to get rid of the venom. North Carolina, a lot of snakes in North Carolina.
Could
Get
you,
rid of
like,
the
Don't
have-
suck it out though. Like
A lot of times
do
you
like
want
the
a
movies.
tourniquet. You want a tourniquet above. I mean, the whole sucking the venom out is literally like trying to whatever is in that specific area to get it out of the blood. I mean, I like definitely don't swallow it, but there is a small
got
thing
it
to
out.
do to like get rid of the venom. Like you
So
want
are
to
you
try to get it out
saying
of the
you
body.
should suck and not swallow?
I said spit, not swallow.
Oh.
But
Next question.
Yeah.
No.
All right.
But no, you definitely want to get rid of snake venom like ASAP. Like
Yeah.
either tourniquet above the bite so that it's not flowing into the body fully, or, I mean, yeah, it's kind of try to get rid of the venom. So it has some
So your
merit,
arm doesn't
but
fall off.
right, it has some
Yeah.
merit, but I mean, it's
Nobody
not
wants to lose an arm.
not the 100%.
People may swallow their tongues during a seizure.
We're back to swallowing. But yes,
They're
that is-
all swallowing questions.
But that is true because you lose like muscle tone, so you can not so to speak like swallow your tongue, but your tongue is like a huge muscle, so it can block your airway.
Yeah.
Okay. But as
Well,
far
and
as
more so
swallowing,
like
was gonna say biting,
biting
yeah.
your
Biting,
tongue.
yeah.
I wouldn't say I've never seen someone swallow their tongue.
No.
It's more like they're not in control of their body when they're having a
Right.
seizure, and you want to turn a patient on their side when they're having a seizure and kind of protect their airway
It's all about
because
protecting the airway. 'Cause
Yeah.
like I said, your tongue, being the big muscle, it can definitely be pushed back a little bit more than it should, and it can block from where you're breathing.
got it. All right. A cold steak can bring down a shiner, a black eye.
yeah, for
Yeah,
sure.
of course. Anything cold.
I don't know if I would eat it afterwards if you're putting it on there
Why
raw.
waste the money? Use a bag of peas then. Why
Yeah.
waste the steak?
Well, if you don't have no peas in your freezer, I mean, put that steak on
No,
there.
yeah, no. Any cold will help with soft tissue swelling.
Yep.
All right, two more. Cracking your knuckles will cause arthritis.
No.
I mean, they tell you not to do it. I mean, I still do it because
If it
feels
doesn't
good.
cause pain, it's not supposed to be bad for you.
I mean, you shouldn't do it,
Lindsay,
but
I
it
feel
feels
like you
good.
haven't answered any of these questions.
I've just been silently nodding and like agreeing.
That sounds great.
Lindsay's like,
You guys are like taking over.
Pour
so
me
I'm just like-
another.
I feel like these are like my
wine.
patients coming in ER though. Like this is what I have. Like this, I feel like this is what I do.
Yeah, because there's rheumatoid and osteoarthritis.
Right, I know. It's not a
so-
clear cut.
so it's
like
not-
maybe.
No, but they say like if it doesn't cause you pain, it's not supposed to be damaging.
Yeah.
If it hurts when you do it, okay, then it could be like more you're grinding bone on bone or causing like ligament or tendon damage. But if it doesn't hurt, they say it's not supposed to be.
And I crack my knuckles all the time. Look at my little baby hands. Aren't they cute? No.
Your poor
okay.
husband.
All right, so we're gonna let Lindsay answer this last one.
Oh
then.
shit.
We're on the spot, Lindsay.
All right, chewing gum takes 7 years to pass through your system.
That's a good question. I don't think so.
I swallowed a lot of gum in my day.
All right.
Yeah, I don't
I was
think
just
so.
talking about this with my best friend and my fiance earlier. Like, do you know how like acidic your stomach is? Like, considering the things that if you choked on a piece of chicken versus swallowing a piece of chicken, like, yeah, your body breaks down that, and like considering the acid in your stomach doesn't eat through your stomach and in like out of your body, like that's pretty impressive. So I don't think gum would survive the acidity of our stomach.
You know
for
what?
7 years.
I just had an EGD and colonoscopy. I mean, let's just be real here,
No
okay?
gum. No gum
There's
was
no
found.
gum in there. I saw pictures. I saw pictures of my colon, and I saw pictures of my upper
Funny-
GI
I have a
tract.
funny story
So
about
there's
this.
no gum there, and I swallowed a lot.
So I had an 18-year-old kiddo. This was a long, long time ago. As a nurse, come in, and the mom was super concerned. You know, he swallowed a sucker whole, and we're like, okay, like. He's like, well, the stick broke off and he swallowed it, and we were all like waiting for more to the story. Like, we weren't trying to be like assholes. Like, I was seriously like waiting for like, and his throat is bleeding or this is happening, and we're like, yeah, like that's what we have stomach acid for. Like, it breaks down anything you eat / swallow. You know, like we weren't concerned at all. And this mom was so mad at us, and we were just, we were just waiting for more to the story. We thought there was something more, and we're like, okay, and she's like, well, that's it. And I'm like, okay. He's
Girl, siphon some poop, girl.
Your
Siphon
kid
that
eats
poop.
solid foods, right? Because everything's gonna digest. He's gonna
You're like,
he's
was
gonna
it
live.
a Tootsie Pop or a Blow Pop?
Just to say,
The gum
by the
will
time
be
he
there
actually
7
went back,
7 years later.
he wasn't in the waiting room when we actually got a room for him. They had gone home.
I'm taking my business elsewhere.
But like, she probably thinks we're like the biggest jerks, and like in hindsight, we probably sounded like the biggest jerks. But like, I literally was like waiting for more. I was like,
You saved
okay,
her healthcare
and
dollars. You saved her a fee of the emergency room.
But no, I don't think gum would survive. Simple question. Simple answer. Answer.
I'll
to that
agree.
question.
Well, I believe on the last one, I think that they said that gum can keep its shape, but it won't stick to your stomach.
Yeah, it's
It,
like
sit in
corn.
there. Right. So
You know,
I
it comes out whole.
I've never actually looked for gum in my feces, but the next
Well, it's like the same
episode.
thing with swallowing coins. Like we have people that
Oh,
I mean, if
yeah.
you swallow like coins or batteries, I mean, a lot of times parents are concerned like if kids swallow batteries, like the only time we're actually concerned is if it A is cutting off your airway, or B if like a battery gets stuck like before it hits the
Lodged.
stomach, because then the battery acid can release. But otherwise your body just literally, it goes through the system and it comes out. And we're really not concerned.
So you have the whole battery on the output? Like
You
it's,
can. Yes, yeah. I mean, typically it doesn't get stuck, and usually it comes
Oh,
out.
I have a great story. Okay, so when I was in high school, we did a rotation like to figure out what we wanted to do in the medical field. And I was down in the ER, and the X-ray tech put up this like X-ray of a pelvis. And granted, like I'm like 17 years old, and he's like, "Okay, what do you guys think this is?" And I see like this spring in the pelvis, and I'm like, "Is this a pen? Looks like a pen. Like it's a spring to a pen." And it was a vibrator that was lodged in this elderly man's, you know where.
Regions.
And that blew my mind. It had to be surgically removed.
Yes.
That
I
happens
have
a
pictures
lot.
on my phone like that. Like, it doesn't, no patient information, but I have pictures on my phone.
People like sit
at
on
least
like
it's not a wallpaper on your phone. Then I'd be
no.
like people sit on like vases and like
Or they fall onto
I fell on a vase.
objects. I mean, those are my favorite. Like, oh, I fell onto the plunger. Like,
That was tragic.
has to be either really, really tragic aim, or you're a liar, and that's fine. Like,
That's the thing. That's the thing. We want
concerning the lack of like bleeding, I was more concerned.
this is another PSA. Like, we just want patients to be honest with us. Like, you know, we might giggle inside and be like, "Oh, that's really unfortunate," you know. But we're not gonna arrest you. Like, if you did a bunch of cocaine and drank a bunch of alcohol, like, don't lie to us about it. We're gonna find out, but we're not gonna call the police on you. So please be honest with your healthcare providers, because we have no intention in getting you in any trouble. We just have to know so we could properly treat you.
Right.
So don't lie about falling on
We have
plungers.
seen a lot.
Yeah. You're not the
So-
first
Yeah.
rodeo.
So, what you come in with, we've probably seen before. You're not the first. You didn't reinvent the wheel. So,
I had a patient who swallowed 2 rats before. It was
that is a new one for me.
yeah, and she did it because the devil told her that she had to do it to get Satan out of her body. So she became like septic after she like
that all
swallowed
you have
these
to do?
rats. And like I said, Tegan just swallowed some
Did you
rats.
see the dirty look she just gave me? Well, obviously you didn't. But
Oh my God.
Between that pause, that was a dirty look.
Yes, Tegan.
Whatever.
Just keep drinking your wine.
I'm drinking your wine. That's true. For the record. No. I mean, there's definitely a lot we've seen, and nothing surprises me anymore.
Yeah, just be honest with
Nothing.
us, though. Be real.
So,
Let's keep it real. Let's keep it 100.
Right.
Right, Linz?
We're
Right.
going to treat you regardless of what you tell us.
Yeah.
We don't care if your pain is a 3 out of 10 or a 20 out of 10. You're going to get pain meds. We're going to treat you There's no reason to be dramatic.
And as a migrainer, I get migraines, so I know what pain is.
Migrainer. Oh my God, she's got her own
Yeah, like,
verb.
it's
She's
legit.
got her own verb. Migrainer.
But when people are like, they're like, I'm in 10 out of 10 pain, and they're on
And you're playing your
Facebook,
phone.
like, or doing Snapchat filters, you are not in 10 out of 10 pain, because when I have a migraine, I want to go lay under a semi-tire and just let the semi drive, because that's a lot of pain. So let's make it more real. And if you're in 10 out of 10 pain, do not be on Facebook
They need to
during
redo that pain scale. Like, have you seen like those like funny pain scale ones? I'm like, I feel like we should, for real, like put these up in
Like,
hospitals.
are you on fire getting chased by a bear?
Am I sawing your leg off? If I took a saw to your leg right now, you're going to tell me this is less pain than what you're currently feeling.
I think we do need to redo the pain scale.
I'm not saying people aren't in pain, but let's not be like over dramatic. I'm in 10 out of 10, like you were saying, yeah. And I'm playing on my phone and Facebooking, and I'm calling my mom, and
It's too bad there wasn't like a hidden panel where you could say, what's your pain in? And they're
Right.
like 10 out of 10, and you're like, oh, our scale's out of 20, so you're fine. It's like,
You know, like you get Tylenol.
like people. I mean, if you come in and be like, "Oh my God, I stubbed my toe," or you came in and like my arm's falling off, like, okay, we're going to treat your pain. Like, let's just be realistic of where we're actually at in the world.
But we all have different pain tolerances.
True. And I'm
We
not
all
saying
have different policies.
True.
We do. So we understand everyone's on different levels when it comes to their pain.
That's why-
But you're
that's why I
not in
think-
pain if you're on Facebook, okay?
That's obviously where we need like some more realistic. Like, if this picture matches you right now, are you here?
Yeah.
Like, if a bear or a wolf is gnawing your leg off, where are we really at on this scale?
So, well, first of all, thank you for doing this. I really appreciate it. I have a great respect for the medical world, especially when I go in, but more so just having a chance to kind of like have an outside perspective and kind of like have a moment to think about it. You know, this has been a good opportunity for me to step out of my job and just go, okay, what's it a little bit like? So it's great to hear the stories and everything, and then also this is going to give me food to think about, you know, later on, and kind of going, well, just how you were talking about the pain scale, this will give me a good life perspective scale when I listen to it. So thank you for doing
Oh, you're
this.
welcome.
Yeah, thanks for having
I would
us.
almost say if anybody has like any feedback or like questions, I mean, I would be open to answering any of the, like obviously not right at this moment, but like, you know, after this airs and
Yeah, if
know,
anybody
yeah.
has ever any questions, you know, we would love to answer your questions. And if you have any reservations about seeing nurse practitioners, or if you are interested in going back to school, or
Or
you
if
want to
make a reservation with me.
a reservation,
Like, you said reservation. I was like, oh wait, you weren't talking about a restaurant.
she's
you
booked.
can make an appointment. But yeah, I would honestly
definitely.
be interested in, you know, people's feedback and like their perspective.
I am on
of-
Facebook. My pain is not a 10 out of 10. So if anyone wants to get a hold of me.
And you could follow me on my Instagram. It's at KatieBeck25. I post fashion stuff too, so it's not just medical stuff. I like to post my outfits. So if you're about that, come on over and follow me. You can DM me for some questions.
So, all right, well, thank you very much for doing this, and yeah, that's this episode.
Thank you.
Thank you.
Thanks, Terry.
Okay, well, there you have it. Hopefully you got some insight from the nurse practitioners, and just as they give a disclaimer on every other medical website that's out there, some of the conversation we had was just for fun, so please don't take it as per medical advice. I don't even think that was the right disclaimer, but anyway, you get the gist. Just like McDonald's coffee is hot, listening to a Gentleman in Moderation podcast should not be deemed as certifiable medical advice. Anyway, thank you as always for listening, and we'll see you next time.